I find this absolutely astonishing. She phoned up and said, look, I'm not feeling right. And they said, oh, it's OK, you can go on the plane.
Well, the word incompetence with a capital I springs to mind. It really does.
Unbelievable.
And now this story is all kicking off, as they say. Ebola is the big story of the day, probably the month, because the scare stories in the newspapers, I predict, in the next couple of days will be saying Ebola is going airborne. You know, we're talking about Ebola being as contagious as the common cold, as flu. It's not, actually. But the suggestion was from some researchers in Chicago is that the body fluids of a patient with Ebola can desiccate and become aerosolized. Right. So little particles can be present near the body for a few feet. So if you're not wearing full respirators, they're saying, there's a possibility that you could inhale Ebola virus that way. Now, we're not saying it's airborne. If that was the case, we're looking at a nightmare scenario with a mortality rate of 70%. This disease would wipe out tens of thousands.
It would be like one of those disaster films,
It would be like the Black Plague again. Now, that's not the case. But they are saying, look, we need all our nurses to be wearing full respirators rather than just masks.
Right.
And I believe that if this is allowed to continue as it is, with people not getting a handle on it, they will have to look at quarantining people in West Africa before they fly out. Because we've now got it in Europe, we've now got it in the States, we've got nurses nursing those patients who are developing Ebola. This is becoming serious. And actually, we need to contain it much more thoroughly than we have up to now. And if that means quarantining people for up to a month before they fly back to our shores, then so be it. We contain it in Africa and get a handle on it.
Yeah, and maybe scientists start spending money, or big, massive multi-corporations start spending money on that rather than other things that they do.
Absolutely.